As previously discussed, the separation between oral health and overall health continues to be overlooked and neglected. Throughout the COVID-19 pandemic, many dental practices were forced to reduce their hours except for emergency services, which contributed to limited routine care and prevention. Public health dental settings in federally qualified health centers were also hit hard during the pandemic, since many patients chose not to seek treatment during the first few months. Hospital emergency departments for dental care were also affected by the pandemic. Before the pandemic, many patients without access to dental care went to the emergency department. These patients were typically young and uninsured. These visits declined significantly during the first few months of the pandemic, and furthermore, many school-based oral health programs which focus on preventing dental caries were suspended due to government-mandated school closures. For children living in low-income and vulnerable communities, this was the only source of preventative care that they received. These types of programs benefit low-income children and families who have reduced access to dental care services and increased rates of dental decay. During 2020, the unemployment rate skyrocketed. For many families, the economic stress of COVID-19 made it increasingly difficult for families to afford the most basic necessities, such as food and shelter. As a result, this caused other basic needs and expenses to be pushed aside, including routine oral health care. This delay of preventative dental services is extremely harmful, since many dental problems can worsen precipitously, and the combination of dental closures and economic stress can result in missed opportunities for early interventions. Ultimately, this can lead to a need for more advanced treatment down the line, which is an expense that many families cannot afford. These treatments are also less likely to be covered by dental insurance compared to more preventative procedures and basic treatments. COVID-19 has accelerated this damaging cycle and pushed families to their limits. So what has the COVID-19 pandemic taught us about the dental field and how we approach oral health? This pandemic has highlighted the importance of prevention in the dental profession, more specifically the shift away from procedural services and instead toward more preventative care. Some of these approaches could include community water fluoridation, promoting healthy diets low in sugar, and advertising oral health in more vulnerable communities. Providers and payers play important roles in promoting the shift toward prevention and shifting reimbursement away from expensive reimbursement for restoration and surgical procedures. Many of these policies should instead prioritize non-surgical and preventative treatments. A shift away from the fee-for-service model is critical in disrupting the traditional model of dentistry.